Our guest today is Dr. Catalina Lopez Correa. She is the Chief Scientific Officer of Genome Canada. Not only she's a medical doctor and a genomic scientist, but she was also diagnosed with breast cancer in April 2023. On the day you were diagnosed, how did you feel? Can you kind of walk us through about that day? And I'm sure it was a emotional and mental challenge.
I think I can start from the moment where I detected a lump in my breast. And it was really, at the beginning, you think, oh, this is nothing. This is going to be, just a little thing. But you still in the back of your mind. And when you say, train as a medical doctor, April 2023, when I got my diagnosis, is like, I think every cancer patient says, is a day that completely changed your life. Yeah. Is a big emotional moment. I wasn't thinking, of course we think like I was healthy. I was, working, exercising, doing, I had no symptoms, no nothing. I was feeling maybe the last year, and I was always thinking, oh, is this because of the pandemic? I got COVID at one point. So is it that I'm feeling tired? It's a lonely journey. Even if people are trying to help, are sending the most beautiful messages, you are there with yourself. It's a very lonely path.
Anyone looking that doesn't have any idea about genomic testing, whether it's on a tumor or blood, and let's say the team of the oncologist hasn't really talked about it yet, how would you like to introduce this technology and cutting edge treatment?
There is a lot that is available now, and it's important for people. As I say, as a patient, you don't need to be a genomicist, you don't need to know all the details, but at least ask the oncologist if they can test your tumor for the genes that might help guide the treatment, and if they can test your blood to see if you have an hereditary form, and if all the people in your family, if you have kids or daughters in case of breast cancer, or if all the people in your family might be susceptible to have cancer. I never had long hair, beautiful as you have. I always had short hair, but I love my hair. And it was an important part of my personality and who I am. I will say it's a symbol. It's a symbol, as much as, the hair is not painful, but when you start, that moment when you start losing your hair, it's like, okay, these medications are, doing the work. Exactly, doing the work they have to do. There's lots of side effects that remain. I'm still, trying to get my hair to grow. It's been since October 6th, I finished chemotherapy. We're ending November. It's going to be 2 months, and I still, for some of the medications I had to take, there were some that were not approved here for reimbursement, and they were approved in Ontario or Quebec. And for the genetic and genomic testing, also, not every patient systematically have access to those. So I think it's important for patients, it's important for healthcare providers in general to be aware of the power of genomics and how genomics is really helping refine the treatment and refine the diagnosis and guide the treatment in a very powerful way. Like, again, in my case, deciding chemotherapy based on my genomic profile is big. I think, as I mentioned to you before, there are other tests that can be done. Of course, the one in your blood to define if you have susceptibility, like hereditary cancer genes, and if you're susceptible to have other cancers, or if your family members are susceptible to have breast cancer.
And I wonder, if you didn't know so much, would you have gone, this, or like, if education is so important for the public and as well as, I mean, any healthcare professional to know about these technologies and genomic tests, because sometimes if the conversations are not brought up, then if you are educated and aware of them, you can start asking.
It's super important. And I think both education for healthcare providers, for the doctors, for the oncologists. I've heard, maybe not in recent years, but I will be publishing in a few weeks another article, and that's about a woman from Dominican Republic that was diagnosed here a few years ago. And even though she said that she had a sister and her mom and one aunt with breast cancer, they didn't send her the test for hereditary cancer. So I think there's still the need to educate doctors, in particular family doctors. Oncologists are maybe more aware now because oncology is basically a genomic disease. It's your genome that's messed up, that they have to know about genomics. So oncologists in general are more educated about genomics. Family doctors, depending, there are some family doctors that are aware and are keen on thinking about this, some others not. So there is a big need of education there. I always say the three biggest challenges we have now with genomics are the diversity. You know, the populations are not represented in the genomic studies. The equity, like some people in some countries don't have access to these technologies. I feel privileged. It's not only that I'm in BC, I'm in Vancouver, where we have one of the best in class cancer centers with cutting edge technologies, where doctors are, at the cutting edge, exactly aware of everything that's coming. They're leading the way nationally and internationally in oncology. So that's really the best place to be. So yeah, access, equity is a challenge, and access to healthcare and access to the genomic tools, to the testing. It's stressful.
It's so stressful. I wonder if you, right now, we're at end of November, if you go back to April, what would you tell yourself?
My God, that's a difficult question. If I knew what the path will be, I will just, I would say a little bit like what I say without knowing, but hanging there, this is for your benefit.
So, losing your hair, this was part of the journey, and loss of hair seems to be a symbol for cancer. And a lot of people, when they see someone that have lost their hair, they associate them with just cancer, and they forget about the life they had sometimes before and even in the future. And, what were your experiences and thoughts on, before and after?
I felt, and I was telling Maria, my partner, I was telling her, people are looking at me. People look at me like I'm sick. I mean, yeah, I'm sick, but it feels weird, even though people try to be, but they look at you like a snapshot. Like if you are cancer, like cancer is such a stigma in our society. There's so much stigma around cancer that when you look like a cancer patient, because some people, I have met breast cancer patients that didn't need chemotherapy, so they didn't lose their hair. Our society is still, a society of the healthy and the wealthy and the ones that are driving and the ones that are. So when you're sick, it's like, stay there. My biggest lesson from this journey is compassion. Like, I think you start to look at people differently after this experience and approaching people differently. Also, your perception of happiness is different. It's like I get the sense of now the need to enjoy every moment. Like I go for a walk and I'm like, I'm alive. I can go for this walk. Thank you, thank you, thank you. So
Living it day by day, feeling every moment.
feeling every minute, and that compassion for others and empathy, I think are hopefully my biggest lessons from this challenging but amazing journey.
Amazing journey. Yeah. It was so lovely to have you. Thank you so much for accepting this, invitation and educating us and telling us about your story. It was very insightful. Thank you.
Thanks to you for inviting me, and thanks for listening to my story.